Welcome to the smooth jazz stylings of the 40 and Fit podcast, brought to you by WNBC. Since John is out again, I am your host, Dave Kalari, and today we have a very special guest, a gentleman by the name of Natty Bandasak. Is that correct? The last name? I don't think I've ever said it. 20 years knowing you.
Yeah, you said it. Yeah.
And then to my far left, we have
Mike Hoban.
And to his right,
Cliff West.
A little louder so the people in the back can hear you.
Cliff West.
Excellent, Mr. Cliff. Thank you.
It's like a competition over here to see who has the deeper voice. I think you win.
All right. So, Natty, why don't you tell us a little bit about yourself? And I missed the call line. What's this podcast about? Diving deep into the male mind on the verge of a midlife crisis.
Oh wow! Okay.
Yeah. So we get in there deep.
Shit, bro.
Yeah,
I'm here for it. If we gotta cry, we'll cry together.
I'm
here for
slightly ill-prepared.
To cry?
Right? No. I'm always prepared to cry.
Okay.
I may have squirted a few tears on my way over, actually. So, Natty, now that you're here, why don't you tell us a little bit about yourself and what you have going on?
Yeah, so first and foremost, happy to be here. Just love you guys' content, so I appreciate being a guest here. A little bit about myself. So, as we are recording the old New York Sport Club, so I guess growing up, I've always been into fitness. I actually met Dave when I first started working at New York Sport Club. On the kids side, right, hosting parties, and then slowly worked my way up to become a personal trainer here in this location. Then, went on to pursue a professional career as a physical therapist. With that being said, movement, exercising has always been my go-to. It's what I enjoy the most, and what took me down this path was just being able to work with clients, being able to get them stronger, faster, lose weight, whatever it is that they want to achieve. But there was a gray area where I couldn't help them was when they were in pain. So that's kind of got my interest in physical therapy. Because I was like, okay, I can help them with this, but I can't help them with that. Or maybe let's try to find a way to bridge the gap. So fast forward, I guess like 10 years since I've been here. I'm a physical therapist. Been doing it for 5 years. I have my own practice called Myokinetix. We are in East Hanover, New Jersey. We specialize in helping active individuals, athletes overcome pain, prevent injury, improve wellness so they can live their lives with no restriction. That's our mission. The company was founded on the idea of inspiring hope and contribute to the health and well-being of humanity, essentially. And I'm very proud of it. It's something that we're doing on a daily basis just to spread positive vibe and positivity through movement, through exercise. And I'm sure you guys, we all here can relate to that because we're here because of that one singular purpose. It was to be able to help someone, right? And fitness kind of unite us in a way. That's why we're sitting here. So that's a little background on me.
You said East Hanover. Don't you have a second place too?
Yes, Randolph. Sorry.
Nice.
Yeah.
Yeah, good for you.
This young upstart's got 2 locations.
Yeah.
And we're struggling to get the first. Son of a bitch. So, like I said, the tagline was, on the verge of the midlife crisis. Now, granted, you're 32, 3?
3, yep.
Okay. So, at your age and having 2 places to yourself, I mean, that's pretty amazing.
Oh, thank you. Yeah.
And what's funny is that I've known you for 15 years, right? You were a baby when I met you.
Yep.
So, to some extent, you're always going to be that young guy to me. But I'm very impressed about everything you've done, everything I watch you do. Before you got to a place where you're like, I want to put my own thing together, did you feel like did I make a mistake? Is physical therapy the right thing for me? Like what sets you off to be like, I need to do my own thing?
I did it out of necessity. To be honest, is when I first graduated from PT school, I had this idea where everything is set, right? So it's like, oh, well, I got my doctorate. I'm good. I'm in a good career. I can just do my thing, ride this wave till I'm like 60, retire, and then that's it. But what happened was when I started my career, I was in a very typical orthopedic setting. I was seeing 3 to 4 patients an hour, working, full day, seeing 16 to 20 a day, right? I would come home, do my notes, get all my documentations in. I'll go to bed by midnight because the notes have to be done before midnight. I'll do the same thing over and over again. And I started questioning it and looking around like, hey, why is this a thing? And that was a standard at a time, right? But it wasn't my standard. So by that point, I knew I really need to find something that I believe in, a model which works in personal training space. Like, why does it work to do one-on-one care in a personal training space, but not in PT, right? So at that point, that idea just kind of stuck in my head. There were other factors, other influences, especially with my wife. She was dealing with some health issue at a time where I needed to take a day to go with her to an appointment. And my clinic director at the time told me that, well, you need to find coverage. And I'm just like, huh? And the guy next to me, his baby got sick 2 days ago, and he was able to take the day without finding coverage, right? So at that point, it was a combination of things where, I wanted to do something meaningful in the field that I love, and I wanted to be able to control my own destiny in a way where no one's going to tell me how I can or cannot care for someone that I care for. So because of that, I told her, I was like, hey, listen, I'm quitting. I'm going to start my own thing. We're going to do PT the right way, all one-on-one, working with people, introducing movement, right? And by the time when I got out of PT school in 2016, physical therapists were not used to moving people, right? They would just TheraBand, 3 sets of 10, rest, ice, compress, right? Where I came from a personal training background, strength coach, used to coach CrossFit, used to compete in Olympic weightlifting.
Because you have your CSCS also, right? Yeah.
Yeah. So what with like various level of athletes, and it was just something unique. I remember the first time having an ACL female patient. She's 6 months out. We had a Smith machine. We didn't have a real squat machine. And I was like, all right, we'll find you 8 RM today. My regional director walked over and said, hey, what are you doing? She's going to get hurt. And I was like, what are you talking about? She's not going to get hurt because she's going to get strong. So there's always a mismatch, right? So I knew I was not in the place where I needed to be. So I was like, all right, I looked around, I was like, this is something that needs to be created. But now I'm looking all over the place. There's places like Myokinetix everywhere. So the newer age PT are now starting to pick up where now most PTs have their CSCS, right? They understand that, hey, it's about, progressive loading, movement, resiliency, right? Because that's the whole thing. It's giving people confidence to be themselves and to trust their body once again.
I still feel there's a big prevalence on like the old thinking though. Like I had a client come in the other day. She's 60 and we were doing leg extensions and I had banded it. So it was a little more tension at the top in the short range. And she was like, oh, my therapist from a few years ago told me like that I shouldn't do this because it's bad for my knees. And I was like, well, were you there for a knee injury? And she's like, no. I was like, do you have like any like patella ligament syndrome or anything? She's like, no. I'm like, well, what the fuck is she talking about then? And she had said a lot of that stuff previously. Like they say I shouldn't do this because I'll get hurt again. And I'm like, well, no. Like we have to get you strong so you don't get hurt again. And I don't know why there's still a big disconnect from like the old way and guys like you.
I think with anything in life, progress just needs to catch up. right? And we're really big in choosing our words when we educate our patients because it's very important. Words do more damage than anything. If you looking back when you were in middle school, like when I first moved here, it's not that people physically pick on you; it's what they say to you that really hurts the most, right? So, as a medical practitioner, I really do my best to make sure I use the appropriate term to guide my patient in the right direction, rather than having someone's coming in like, oh, I have bulging disc. Everybody has a bulging disc. But it's taking the time to educate them like, hey, because you have low back pain, that's why you went to get an MRI. That doesn't mean the bulging disc is causing you pain. It might have been there for 10 years. And you wouldn't go get an MRI until you have pain, right? So there's really no association with that. And again, as therapists, we need to be very careful in how we explain things. Because, again, she might have heard that PT say to someone else, and that stuck with her, right? So, rather than focus on like, hey, you can't do this, you can't do that, you shouldn't do this, really take the time to understand, like, hey, what the individual needs are. Why is this movement appropriate to this person? What are the goals, right? And then tailor that appropriately to the patient. And just like any field, there's bad trainers. There's someone who's kind of behind the curveball, right? But things kind of sort itself out, really. It's kind of like natural selection. That's how I say it. Yeah.
Well, who do you refer anybody PT wise? Like, do you have someone you have a go to for all your baseball guys?
I do. I have a couple local guys who I refer to. One guy is Alan Roth.
Oh, I know him.
Yeah.
He did some stuff with RPM when we were doing meals.
Yeah,
he's out of Active.
He was. I don't know where he is now. Luckily, I haven't had anyone hurt in a while.
Okay, that's a good
point.
But
he was working out of the Equinox in Paramus.
Yeah.
Is that where that location is? Yeah, and I normally just send him his cell phone number.
Okay.
So he's one of my go-to guys. I have Dr. Greg Dorr, who's phenomenal. He does scraping.
Okay.
And on top of that, he also gives like a lot of corrective exercises, and he has like a physical therapy background as well in what he does. But Natty, I was going to ask you, why do you think it is? I mean, I have my own opinions, but why do you think it is this field is so slow to change? Because there's so much research going on, but it takes so long to get accepted.
I think it's all come down to awareness individually. I think, change can only start within yourself. And if you lack awareness on what you're good or bad at, you would not curate any change, right? So if you're very comfortable, I think the word is comfort. If you're very comfortable in, hey, I've been treating this way for the past 10 years. I've been getting result. It's confirmation bias. So like, why do I need to go out and do something else? Because it's been working. We're all creature of habits. We don't want anyone to do anything to throw us, out of our way. Everything's a hassle. So I think that's part of it. It's also the fact that clients or patients are not demanding for more. I think they just kind of like, okay, all right, so I just kind of have to put up with this, right?
I think a lot of it, too, is the clients and patients have a feeling of vulnerability, especially if they're coming in and they're injured.
Of course. Yeah, they're super vulnerable. I mean, when you're in pain, you're not yourself. Your identity that you have is being taken away from you, right? Just kind of tailored back to your podcast specifically, when you go through, I assume, midlife crisis, is there something that's mismatched with your ideal? Like, there's an ideal place where you want to be at a certain age, and the reality is not matching up, where it's very similar when you're injured. Because if your identity is to be able to, I don't care if you want to go to like Soul Cycle for 4 times a week, but that's part of your identity. You're part of that tribe, their community. If you have patellotendinitis and you can't cycle, that's get taken away from you, right? So I think it has to do with how people perceive themselves, and we're in a space where people come to us for help just to see that transformation to be a better version of themselves. So whether the injury or they're a little bit overweight, they're not happy where they are.
You've had a lot of NFL guys come through your place, right?
Mm-hmm.
Are the pros more susceptible to that, this is my identity, than a regular? Because that's all they do, right? Mm-hmm. Do you feel they're more susceptible to that whole, like, this is my identity and I'm hurt, what am I going to do? Or are they kind of used to, like, this just kind of comes with the territory and I just need to get better?
The pro guys, I think, can deal with it very well. My main concern are the adolescent athletes, mm-hmm. right? Someone who's played clubs all year. If you work with baseball guys, they're always traveling. That's their people. As soon as you have like a Tommy John or like a little league elbow, you're out for 6 weeks. Now you're missing out. Now you're not part of that group chat. You're not part of that Xbox Live. Yeah. No, I mean, there's time where I just sit my athletes down and just have a really heart to heart with them. Like, hey, you're missing out on some stuff. I totally understand. It sucks. But this probably the first time you get a true rest from the sport. You get to discover other aspect of you as a human being. What else do you like to do? Can you cook? Do you like to bake? All these other things. But
do you tell them your favorite recipes? That way they can make you shit and bring it in.
No,
the clinic?
I just say, hey, watch some cooking show, get some cookies, and then just bring them in.
Brownies tomorrow.
Yeah, but no, those adolescent kids, my heart is for them. That's my favorite population to work with, honestly, because they're so impressionable and want to make sure we steer them in the right direction.
Do you think that depending on where they're going, if a kid just comes in, they just play varsity, or someone who's on track to be like a D1 player, does that change their perception of like how fast they want to get better, or you know what I mean?
Yeah, there's definitely a sense of pressure to do well from their peers, from the coaches, from the parents, which is why it's important that when they first come in, we really have a conversation that put them in the driver's seat of like, hey, this is your body. Your coach is going to tell you one thing. Your friend's going to want you to do something. Your parents going to want you to do something. At the end of the day, I'm here to work for you. I was like, it's great your parents drove you here, but I don't work for them. I work for you. I was like, and I have dispute with parents and coaches before, and I go to bat with my athletes for sure. I have parents walked out. I was like, okay, well, I'm not going to clear them. They're not ready.
Do they take the kid when they walk out, or are they just like, you don't know what you're talking about?
Yeah, they took the kid, but then they came back. Because, I mean, I'm going to stand my ground in what I believe in and what the research is showing. And the last thing I want to do is jeopardize that kid's future. Because we're all that athlete's face is a face. That individual is going to have their own life. They want to have their own family. They want to be able to run around with their own children, right? So I'm not going to let this short-sighted individual make decision for that kid, right? I mean, my role as a provider is to also protect and look out for the best interest for my patients, and that's what I have to do.
100%.
Yeah.
100%.
So now that when you're dealing with parents, right? So we've kind of talked about this before, like how much are the parents putting their experiences like through the kid, right? Like I was an athlete and I did this, so you're going to do this. Because as we talk about the subject matter of the podcast, really, parents will come in, maybe they're out of shape, maybe they used to be athletes, something like that, right? Do you see a lot of parents who do come in like really pushing their own agenda through your kids?
Yeah, I mean, I have to say yes, just because they live in their life. They want the best for their kids. Again, I think this is all coming from the best place. Again, kind of going back to the midlife crisis thing. Perhaps they're reflecting in their own life and say, oh, man, I wish I would have done this differently when I was in that age. Why don't I just push that agenda on my children to make sure that they don't repeat what I did?
Yeah, my regrets.
Yeah. I mean, that's all it is. It's a mismatch from reality to expectation.
Yeah, it's coming from a good place, but
it's coming from a good place. Yeah. No,
but God forbid they should ask the kid like, "Hey, what do you want?"
Yeah.
I didn't get what I want. but I would rather see you get what you want.
Yeah. And, I don't have any kids, so it's hard for me to speak on that, but they absolutely put their agenda on there. But at the end of the day, when a child is hurt or anyone's hurt, it's a family dynamic thing, right? So if you're, as a parent, if you're listening to this, I think the best thing you can do is really figure out, do some self-reflection. Why do I want my daughter, my son to do this so much? Is this what they want, or is this what I want? Right? When was the last time I really have a good conversation with them? On that car ride home from practice or whatever, what are we talking about? Are we talking about how well you play? Can we talk about hey, how do you feel after you play? Hey, what do you think about the sport so far? Hey, how's everything else going? Let's not talk about, man, you just had an awesome inning. You pitched so great. Great. That's at the end of the day, let's really talk about how the kids are feeling mentally and emotionally, rather than just identifying. So twofolds with this, right? When you exert your agenda onto the athlete then identify with that. When they get hurt, that's when they lose that sense of identity, and then they downward spiral into depression, right? So it's like a cause and effect thing, right? If you don't make it a big deal that if you just say, hey, listen, being an athlete is 1/3 of your job. You're still my kid. You're still a student. Then when injury happens, they don't lose their whole sense of self. They still have other things they can thrive on. But you're going to put all your eggs in one basket and hoping this kid's going to ride a wave to D1 and then go to pro and then, be on ESPN top 10. And then it's a very slim chance we're talking about, right?
Less than 1%?
Mm-hmm. Oh, yeah.
Well,
yep.
Much less than 1%.
Mm-hmm.
So the NFL guys, did they come to you as pros, or did they come back to you at you saw them maybe in college and then they left, got hurt, came back, or?
It's both.
Yeah.
It's both. Yeah, I've been very fortunate to be able to work with both. Some I've seen transition from high school to pro. Some I've seen just been referring to me. So it's a good mix.
So let's go back to you're not a parent. Any plans to be a parent?
Yeah, absolutely. Yep.
Okay.
Can't wait to push my agenda. Yeah, they're gonna play odd sports
with curling.
I'll tell you what. I mean, there's no snow in Thailand, so we can represent the Thai team in curling. So
there you go.
Yeah.
You're not gonna play takra or anything like that?
No. We're just gonna go to the lowest hanging fruit to get us to the Olympic.
Bobsled, I love it.
Yeah, that's it.
Oh my God.
Too much head injury. My wife would not like that. But listen, curling is a sport where you can just play, drinking coffee at the same time. Looks cool doing it. If you can show up in a nice sport polo and you can compete, that's fine.
Yeah. That's awesome.
Well, it's funny you mentioned that, because I was going to say, I mean, clearly, if no one's ever seen Natty, you can hear his accent. You said you were born in Thailand?
Yep.
Okay.
Born in Thailand, moved here when I was 12.
Okay. Why did your parents want to come here? Do you know?
Oh, yeah. I mean, any Asian parents will tell you why they do any sacrifice for you. We
have to ask John about that.
Yeah.
John's Filipino.
Well, yeah, I mean, it's better opportunities, right? Thailand's still a third world country. Is it? Yeah. Thailand, to me, from how I remember it, so they might be on the up and up. So to my Thai people listening here, don't hate me. But they know there's a sense of limit if we were to stay there, right? And because we had the opportunity to come here, is to quote Aladdin, it's the whole new world that we can experience, right? So they took the leap of faith and they came here.
Did they impress upon you anything? Like when you decided to go into to be a therapist, were they like, what are you doing?
No, I mean, the goal was to get some sort of doctorate degree. This is, I guess it's a cultural thing, right?
Right.
You want your kid to have a doctorate. And who was the comedian? Maybe Joe Coy. He was like, nothing changed the narrative, an immigrant narrative, quicker than your kids getting a doctorate. Because now you just, boom, you just go from like 0 to 100, right? So that's the best way I can put it. Yeah, absolutely. Education was always instilled upon me when I was young. And at the time when I was finishing from at University of Maryland, I was coming home, and I was at a crossroads. Like, hey, am I gonna find a job, or am I gonna keep pursuing this? And luckily, my wife, was my girlfriend at the time, was pushing me. It's like, hey, you really like this? Why don't you just go do it? So it was great. My parents obviously support it. They're not gonna say no to pursuing higher education, so it's just a real no-brainer.
Did they help pay for it, or did you have to do that on your own?
No, I have to take out the loans.
Oh.
Yeah, it's all right. I mean, I looked at it as an investment in myself, and I'll do it 10 times over. I'll bet on myself any day.
Do you have plans for a third location? Or are you not there yet?
I'm just, we're just gonna take it day by day. The plan is always there. I like to challenge myself. I like to grow. Because at the end of the day, while I'm still 33, at some point, if I hit my midlife, I want to make sure I look back and I'm like, oh man, I didn't really leave anything on the table. It's there for me. I did it. I have minimal regrets. I'm not going to say I'm not going to have any regrets. I'm going to minimize the regrets as much as I can. And then, just speaking on the next generation, when I become a father, I want my children to be able to look, and like, they don't have to do anything that I have no agenda with that as far as like whatever they need to do, but I want to make sure that whatever they witness, is something meaningful rather than just me showing up and then just, all right, I don't want to be aloof. That's all it is. I don't want to be just a floating piece of garbage, not garbage bag.
Wow.
I'm sorry, plastic bag, and just have no direction. That's it.
That's funny because John is the only one out of the three of us, or the four of us, that has kids, right? Because you don't have any.
Oh, hell no.
Not that you know of. There you go.
Yeah, and Cliff doesn't, and I certainly don't. So he talks about, and it's funny you say, I never knew you were that old when you came here, that you were 12. Uh-huh. So essentially you've been here for 20 years.
Yep.
Which is how long I've known John. And it's also one of the things John's like, where did the last 20 years of my life go? Mm-hmm. Only because he's unsure if he's made some of the right decisions, he's on the right path. And I think he's made plenty of the right decisions. I just know sometimes it comes down to less of, like you said, like, where do you want to go? Mm-hmm. Sometimes you have to have an ideal of, I kind of want to go here, so let's just follow that path a little bit and see what happens. Mm-hmm. Which is why I said, do you want to open up a third place? Like, where else do you see yourself going? And first of all, are you on the younger side of guys in your field who have their own facilities like you do?
I think I am on the younger side, but just to kind of backtrack on what you were saying before, as far as like finding out where you're going, it's almost like I think about this all the time. Is that, let's say if things didn't work out for me, right? How would my parents able to justify that decision, right? Because sometimes you don't know if you're on the right path until you look back, right? And that's how we usually do it. You can only project forward so much until you come back and you look back like, oh yeah, I made the right decision because the end result is exactly what I wanted, right? Where if it wasn't, was it a bad decision? Did you learn from it, right?
I say all the time, you're never really failing, you're never making mistakes. It's just you learn for the next time you're in that same position. Hopefully you make a better decision that furthers you to wherever you want to go.
Mm-hmm. Yeah, and at this point, I obviously, like, to answer your question, I think I am on the younger side compared to my peers who have their own practices. But I feel like that I'm like older soul-wise, because my dad passed away 2 years ago.
I think it's the time zone between Thailand and here.
Yeah,
that's
it's
probably
huge.
Why.
And since my dad's passed away,
was he sick? I don't know.
No, he was healthy. Sorry. It was.
I'm sorry to hear that.
No, unexpected. And it just forced me to grow up. Really, I mean, it just took I switched gear to the next level.
Were you in the process of opening Myokinetix at that point?
I was actually doing pretty well at that point. I feel like I was on the top of my game. The clinic was doing well. I was working with tons of pro guys that I was reading about when I was younger. So I felt like I'm really on top of my game.
Were you happy that he saw that? Like, it's great that they didn't impress anything upon you, but to have your dad see you get to where you thought you were crushing it.
Yeah, oh yeah, no, I was really happy. He saw my last clinic before I have my new clinic.
Right.
So if he saw this one, he would definitely be blown away. But regardless, he was able to see what I was able to make for myself. But needless to say, that was a very humble experience for me, because you can have everything in your life go so well where a single moment, it can all just go in different direction. And to me, it was a lot of self-reflecting, a lot of reading, a lot of meditating, a lot of dealing with personal past stuff, and just being vulnerable, honestly. Like, I mean, my wife was a huge, huge support for me during that time. When you're grieving, you just kind of lash out to the person that closest to you, which, I don't know why, but apparently we do that as human beings. But yeah, it just put a lot of things into perspective. And now I don't really spend time thinking about whether I'm making the right decision. I'm just spending more time thinking about, hey, is this something I want to embark on? Like, how does this, like, if I make that decision, like, would I feel proud? Would I feel fulfilled? Would I feel excited about it, right? Because I always have this concept of an hourglass counting down on how long I'm going to have left. And I want to make sure that I maximize as much action, life experience as much as possible. So I think that's how I mean, I'm kind of curated like my own little bubble in a way. Like, I'm in my own matrix where I'm just like, all right, people doing whatever, I'm just going to do this. This makes me happy. I don't know why. I have some reason for it. I'm just going to do it.
Well, I said this last week with Lauren and Andrew, who you know from Englewood. Mm-hmm. He was doing something for his old one of his wealth management people, and they was asking the question, would you rather know how you're going to die or when you're going to die? And I remember saying, I think I would rather know how than when, because like your point just now, you said, I'm just going to do what I want to do. Mm-hmm. Your time is limited, regardless of short, long, whatever. Mm-hmm. But it's to have like that fake parameter of like, oh, I have to get it done by this day. Mm-hmm. Well, just do the stuff you always want to do now. Mm-hmm. So then you're never really thinking like, oh, I should have done this or I should have done that. You're always doing things that are fulfilling. And then hopefully you don't start your own podcast in another 10, 15 years wondering where your life went.
No, I mean, it's a great point. I would have exact same answer as you. Yeah. But I think it's always because Natty has his own podcast too. Yep, the Myokinetix podcast.
Yes, available on all platforms.
No, yeah.
But I really like the guests that you've had on, and you guys delve deep into all this stuff, like the journey, kind of finding your people, finding your purpose, kind of thing, and it's really great. And even going back to the point you said first thing was like, you can treat the injury, but the pain and the identification with the pain and what that means to them as their personality, it goes so much beyond just like, well, here's your compression, here's your ice, here's your exercises. And I really like what you guys are doing. Do you feel like that approach is newer in PT? Or is this because I'm hearing it I see it from you, I hear it from you, and then I hear it from these other people?
Yeah, I think the PT field as a whole is on an up and up. Like, and I'm very proud to be a PT. I love what I'm seeing from my peers. We're doing the right thing. We're changing the game. It's evolving constantly. So I'm not the only one, and I shouldn't be. Because that's how. You want to leave the place better than you found it, and that's the whole concept. And I think the younger generation are doing a hell of a job. as far as like, because now I can confidently send, if one of my pro guys and one of my athletes are going to different city, I know who I need to send them to because there's so much resources out there now.
Yeah, I like, I don't really refer out to too many people just because I don't like anybody. But I now that I think about it, I'm pretty blessed that I have, for certain things I can always try to send people to Rafael, to Castro, right? Yep. And then luckily I haven't had anybody really to send your way because then that would mean they're in bad shape. But, Natty's another one. Because you went to Rafael's what was it? Was rock tape or was it scraping?
The blade scraping, yeah.
And how was that?
It was a great course. I mean, he's a great teacher, obviously. And yeah,
you don't think he's too loud?
I mean, to be fair, that son of a bitch, he was like, he said it on the podcast. I said, Natty's going to be on soon. He's like, you guys better have subtitles. So you son of a bitch. Listen,
I know Ralph so long. He's a great dude, yeah.
When he was teaching though, did he happen to bring up how things are changing? Because I don't know anything like where PT was. I just know what I think it should be.
That was a lot of conversation, how things are moving away from the insurance model where you had those places where you have to do 3 to 5 people an hour just to make the same amount of money you'd be making otherwise, and obviously the quality of care goes down because you're giving less attention and the state of like unnecessary surgeries and more conservative things like in the line of what RAF does and what I'm sure other people do is, and like you can do so much more to address through movement rather than just and to go back to an earlier point about like the quality of a lot of physical therapists, like I've been doing some of these courses and like asking a room of physical therapists to demonstrate a squat is one of the funniest things because the movement competency just isn't there for obviously the general population and unfortunately a lot of professionals out there too. That's
one thing I don't understand. To see, we have a physical therapy practice in the gym upstairs. It's going to remain nameless for right now because I do like the doctor, but someone who no longer treats there still comes to work out. And when I watch them work out, I'm just like, oh God, if like this is what you think is like the right thing for you to be doing, I don't think I'd want to be treated by you. Mm-hmm. And that really rubs me the wrong way. And I may point this person out to you if you guys are ever in the building at the same time. But do you believe that should there be some strength and conditioning taught in DPTs?
My program where I graduated from, Dominican College in Orangeburg, they are very heavily invested in training their PT student in some sort of progressive loading, just the basic. And for us, as an affiliation, we have interviews set up before a student come to us, like about their movement competency. How can they progress? Can they digress? Are they comfortable loading people? Are they comfortable coaching and cueing the patient to move the right way? Do they have the eye for it? That's another thing, right? Because as you get better, and you guys know this in this field, you can see movement totally differently. It's almost like you're seeing the Matrix. You're like, oh no, you just got to hinge back a little bit, right? And then you and I can talk about. We all can talk about this really. Like 2 months ago, I was doing the bell squat machine, and Dave's like, "You like this thing?" I was like, "Man, I love this thing." Right? And then what do we talk about? We talk like loading how I approach it, how I hinge it, where do I place it, right? And it's just all a conversation of how do we make this tool applicable to the individual's needs, right? Is this appropriate for someone? Because it's not the same size fit all, and that motto is dying. Yeah. It's absolutely dying.
It's got it. Mm-hmm. I mean, there's far too many individual differences from person to person that one size just, I mean, the fact that we followed that model for as long as we did, it's kind of reprehensible, because, I mean, you're going to treat Dave the same way you treat someone like Rafael. They're completely different bodies, completely different strength levels. Dave is much stronger.
Yeah. I was going to say that. Yeah. I was
so the fact that people are trying to, fit a bunch of square pegs in round holes, really silly.
Yeah.
My girl hates it when I do
I
that.
love the belt squat.
Yeah.
You do?
I do. I love it.
Well, it depends. I don't like the one we have. We have the pitch shark.
Oh, dude, I kill to get a pitch shark.
So
Love the pitch
I like
shark.
the Elite FTS one.
Okay.
Or the West Side Barbell one.
So do they have, it's the belt that goes to the cable and goes, because I just feel like
two pulleys on it.
the loading pattern is better.
Yeah.
Doesn't mean what he was doing was wrong because he
right.
was trying to make it fit for the shortcomings of the machine, but it's the belt to the moment arm to the fulcrum over here. And I'm sorry, everyone who's listening has no fucking clue what I'm talking about, but these guys do. So it's just the way you have to position yourself. But he really was getting the most out of that machine just based on his execution. So, but that's why he does what he does.
Yes.
Standard Joe Schmo's going to get on that thing and just rip out a bunch of really terrible reps.
Yeah.
As long as, they're not loading the spine, thank God.
Probably have a hard time doing it afterwards.
Yeah.
Well, I guess now we're on this topic of square pegs, round hole. What are you guys feeling about the online fitness realm? Are you guys opposed to online coaches and not having that one-to-one interaction in person? Because I feel like that's where the field's going, and I feel like since COVID, PT is the same way. There's a lot of remotes. Telehealth was a huge thing in PT. So I would love to hear you guys take on that because I think for telehealth for us is here to stay, but the insurance reimbursement is not going to be there, so people are going to kind of trail off. But I think when it comes to fitness, I think it's really here to stay.
John likes to ask this question a lot, and rightfully so, because he feels that this place didn't capitalize during the whole thing. We did. We had the Premier Access where we did it free, and then it turned into a paid model. And I don't know how well it's doing at the moment because I'm not involved with it anymore. But I do know that Andrew and I talk about doing like exercise libraries and online programming, but like real high-level stuff. I think it has a great potential, and I think it's something that needs to be there. Nothing's ever going to replace one-on-one. You know this.
Yeah.
But if you can put out into the ether, whether it's through your advertising, social media, or whatever, and that you have a particular service that someone in like North Dakota wants, then great. I think in that regard, it's more about building a reputation that other people can kind of latch onto and kind of gravitate towards you. And then it's, like I said, once you have that reputation, it's like, okay, why do I want to go to this place? Because this person with this programming is there. So, and it's tried and true, and it makes it more attractive. Yeah. And I think that the big box gyms, they're always going to be a thing, right? Like you're always going to have a 24-hour, you're always going to have an LA Fitness. But I don't see it being the same type of moneymaker that they were. Like the people who sign up and you're just blowing through EFTs every month. Oh, I completely forgot. I think the higher end stuff where you're delivering a very specialized service is where things will trend more towards, like you were just like a regular trainer years ago, right? And now it's only baseball?
No. I train everything.
Okay.
I train everything. I even do. I have like general population primarily.
Okay.
But I do everything.
Okay.
I attracted a lot of baseball for a while because I had good luck rehabbing a few people who kind of were banging their heads into the wall with their orthopedist because the orthopedist didn't know what scapular retractor was. Evidently. And he knew. It was just like, oh, your elbow hurts. Let's work on your elbow. Doc, it ain't his elbow. That's just the symptom. That's not the problem. And so that's just the way baseball kind of found me, if that makes sense.
Okay. Yeah.
I'm not that much of like a big deal.
I
am.
He sounds like it. Sounds like it.
No, but look at I guess to your point with the big box gym. Peloton completely capitalized this whole thing, and I think people would just they're not going to pay for substantial, like mediocre service anymore. And I think, they're still going to be there, right? It's a different price point. I do think that micro gym or like boutique fitness, I think that's going to really flourish to the top, especially if you have like small group training, right? Because now people don't want to be near each other.
Yeah.
Right. So yeah, I think it's really interesting. Just, I mean, very similar to my field where people are no longer just going to go to a PT clinic that's seeing 3 to 4 patients an hour when they see someone one-on-one, right? It's depending on how much quality care do you want to get.
Almost any time I hear someone going to PT and they say, "Oh, I'm going to Excel or Kinetic or Kessler," I'm always like, "Just fucking bullshit." Like, I've got at least 2 guys I can send you to. Like, please, are you willing to change? And sometimes they say no, which is kind of, and I don't know if it's an insurance thing because those places always take insurance and it's not an issue. Or maybe they just feel comfortable or they don't know enough to think like they're being churned through the mill type of thing. You know what I mean?
I think it's also doctor recommended by some.
Yeah.
Places,
Yeah. That appeal to authority. And I understand it to a point. Maybe I just need to change my approach. Be like, that's fucking stupid. Like, you should go here instead. But I do sometimes ask them, like, do you like it? Do you feel yourself getting better? The only time I really seem to break through is when I say, okay, whenever you're done, will they be giving you like a program, like a strength training program or things that you should be following? Like, do you do that when you're done with somebody?
They get the home exercise. They have a video library for themselves where they know.
Is it them when you're doing their therapy, or
it's them? Yeah, we make sure we record them doing it the right way. I mean, that's part of the experience that we want to tailor. We also have on our Instagram page we have weekly video exercise update. Like monthly, we have different kind of series. So like this one is all about like spine warm up for any rotational athlete, right? Golfing. Hockey, baseball, summer ball's coming around. So we try to tailor to the needs of the people during that time, right? So, my whole thought process is always to give out value as much as I can. If I cast the net, I give out value, and our message, connect with that individual and they want to work with us. Great, I would love to have a conversation, and we're selective with who we work with as well. Because it's a two-way street. We want to make sure we're the right fit for you, and same thing, if you're the right fit for us, just because as a trainer, I've been there where I'm training someone and they giving me nothing. And, and it just turned out to be a long 1 hour, right? And you guys can relate to this, where if you look at your schedule, like, oh man, that's going to be a tough one at the end of the night. And we don't want that, right? We want, if you give me 100, I'll give you 110, vice versa. And, just the resources, all the ebooks that we have, all the article, all the blog that we have, it's just for people to take advantage of it. They don't have to come to us. And that's the thing. We just want to shed light that there are solutions out there. The whole point of the podcast I started during COVID, again, back to just inspiring hope. Because I didn't know when the lockdown was going to happen. Or how long it's going to be, but I knew that my athletes that were seeing me and my team for a couple of times a week, they're going to feel lonely. And the whole point of the podcast is to be able to connect with them by interviewing them or their peer or someone that they can relate with. So that way, when you hear the message, you're like, oh, I'm not the only one. Oh, this person got through it. And that was the whole singular purpose of that podcast.
You guys should start a research review. Every month you go through the newest therapeutic modality research and just put it all together. That kind of dictates where you're going to take some of your treatment. I don't know, charge like $10 a month for it.
I mean, we do. We have like a clinical meeting every Monday just to talk about patient case. What's the evidence? What are we doing? And with my clinic, it's very unique where we, just like how you guys did it at the gym, where we share caseload of patient. It's not just like my patient. And then so, Dr. Chris and Dr. Matt, we all work together because I don't ever want my bias to limit the potential of my clients can get. So we want, the whole thing is to build a team around that patient, right? If you can have me, why just me? Like when we have 2 other great PTs there, right? So that was the whole point. That's why we had that conversation. And to go back to the research with you, Dave, is that we feel that if you read our blog, there's research there, but we do it in a way where people can digest it, right? Because as you're a nerd, so you'll read research paper where they just want like a nice bite-sized chunk where they can digest and understand what's really going on. And going back to what we talked about earlier about using words, if we start using medical jargon, then people get intimidated, right? How often do you guys go on, I don't know, WebMD and actually read the whole thing through? Right, you shouldn't go on it anyways, but because it's all end up in cancer.
WebMD, well, it should be enjoyyourcancer.com.
Yeah, exactly. Everything is cancer. Yep. But the research there for us for sure. We have an instance where a mom brought in a research paper for us regarding for her daughter, and it was just funny because that research was from 2012.
What was it on? Do you remember?
I was like on some like patella pain or something where it's from 2012. It's backdated. Where we appreciate her bringing it in, but we're pretty up to date with what we have to do.
Yeah. I remember. So I tore my bicep in 2016, I think it was, and at the time, the distal biceps button was a fairly newer procedure because somebody I knew in Montvale maybe a year or two prior had a different procedure, and he had like big scar, like a big scar here, and then they had a scar up here because they had to pull the bicep down. So yeah, I mean, stuff can move pretty quick. Did you have the same thing I had?
I had a distal tear.
Okay.
But they fucked up.
We know they botched it, but did you have the same procedure, the bicep button?
I believe so. He didn't tell me the name of it. He
just
said he described it very similar to what you described with yours. So it's basically just going to pull down, drill into the bone.
Yep. Yeah. And I'm curious now, is it the same thing now or is it even better? I mean,
could be.
I don't know how it's going to get better. I mean, this scar is 1.5 inches, and the doc said it took like 19 minutes to do. Mm-hmm. You know, what can you do in 19 minutes? Impress me.
Yeah. I don't know. I think I'm in the space where I don't need to impress you anyway.
No, you really don't, to be honest with you. Completely.
I think, people who are high performers really take pride in what they do. We're always looking to push boundaries, right? Just like you guys. You're up to date on your research. You're up to date on what you need to do to get your clients going. I'm no surgeon. I hop on the call with them where they'll call me and tell me about like this new thing they're doing. Whether it's ACL, Tommy John's, just a different things, right? Different avenues. And also the rehab is always evolving as well. Like we'll do a lot of blood flow restriction when someone is post-op now. So we're the blood flow, making sure that we get people moving early, safely, that we're preserving the muscle mass, really no atrophy, right? So maybe your bicep could have been a little bit bigger now.
Maybe. But to the point earlier, it's like I remember I had never been hurt before. And when I took the brace off and my arm was like a wet noodle, it was like the size of my wrist all the way up, I was like, don't anybody look at it. Yeah. Like, I felt really terrible about it. Mm-hmm. Like it was part of my identity until eventually I was like, well, it's going to come back. It's going to get stronger. So stop being a little bitch about it.
That's when you start wearing tights. So you distract them from the bicep. That was the whole plan. Because I remember he never wore tights before, and I knew.
Yeah, no, I was trying to be like, I've got 4 arms.
Yeah. Look the other way. No, it's amazing to me where with the short period of time I've been in a PT, the way I'm treating is constantly changing. It should. Like if I'm treating the way I'm treating now, 3 years from now, I'm not doing anything. I'm not learning anything. And that's to me, being stagnant is the scariest thing on earth for me. Because I like to keep moving, not physically, but keep moving mentally and just really challenge myself.
Well, I like every once in a while, I'll have clients who come in and then I'll just shoot Natty a quick question. Like, we had that conversation like a couple months ago about ice and how it's starting to trying to move away from it because, you need some of that inflammation to kind of kickstart the body's recovery process. Mm-hmm. But like he's on it. And I always know that if I have a question about something that's new, that most people are kind of slow to get on the train. I'm like, I know you'll have an opinion on it because you're trying to stay ahead of the curve. And I do see that a lot, though. I do see a lot of people still getting prescribed like old school stuff. Mm-hmm. And it's kind of like, oh, what's taking so long?
Yeah.
Like, where do you go? Like, what do you use to stay up to date?
Well, first and foremost, my team, Dr. Chris, Dr. Matt. I mean, I have absolutely world-class team. They're reading research paper all the time. Anything, I lean on them to keep me up to date. We're hosting 3 courses this year. That's how I stay up to date as well.
I heard you're going to have a nutrition seminar at some point, and some RPM guys supposed to be there.
Yeah, I heard. I haven't heard anything back from those guys yet.
Sons of bitches.
Really? Yeah, that sounds like a sham.
Multi-level marketing scheme.
Oh, God. Buy these supplements.
Actually, no, but seriously, I want to come and talk to you.
No, absolutely. I think it's great. Nutrition is underutilized, just like sleep.
Yeah.
So, going back to the ice things, like people get really obsessed over one little things when why don't we just talk, rather than say, hey, this doesn't work. Why don't we just spend more time like, hey, here's what you're not doing. Why don't we just focus on that? Because it's again, I think my response is like, wow, people have a lot of times during COVID, right? And why don't we just bring each other up, because I don't really participate in an online forum or anything just because it's more people tearing each other down than bringing each other up.
Well, they want to be right. They want to yell into their own echo chamber kind of thing, right?
Yeah, but with research and everything, you're going to be right for maybe 2 years tops until something come out, right? So, I'm trying really to curate this thing as part of my life where, I'm not seeking to be right. I'm really seeking the truth. Mm-hmm. And the truth is always somewhere in the middle. And then really figure out okay, why was that? Why did that person think they're right? Right? If I really want to dive down into it, right? But at the end of the day, if you're in the same field, why don't we not just elevate our field together? Just like where you guys are, I'm sure there's different training method. There's different. And I follow obviously Dr. Mike on Instagram.
Yeah,
he's hilarious, and then he goes on debates with other people all the time. But I think that's good information just for educational purposes, right? I don't think he's there to tear people down. Really, it's just there to hey, let's have a good discussion about that. I think that's okay. We're not talking about religion. We're not talking about politics. I don't think we need to yell at each other.
No, I think one of the best things is to teach people not to get so emotionally attached to modalities or machines or exercises, right? They're just tools.
Yeah.
So just understand the use of each tool and the job and what the job calls for, the job being either the patient or the client, and then just apply whatever you need to apply.
Yeah.
And I thought about this yesterday. I was listening to your latest episode and you talked about finding your tribe. And I mean, it's great. I agree with it. And sometimes people get very dogmatic about their tribe, team full ROM and all this other stuff. And then that's where the emotional attachments happen. It's no, we're not trying to do that. Just here's what either the research says, here's the modality, this is how it works, this is who it will work for. So just now go off into the ether and do your thing.
Mm-hmm. I think at the end of the day, I think it's back to you, John. Just find your purpose. Understand yourself, and if you know yourself, then you can kind of figure out hey, I like this information. This aspect of information really applies to me, but the rest is not. You don't have to take it all in. It's okay to take 20% in, and then there are some things that I'm oh man, that's a really good point.
That's what I tell the doctor with the white glove. I'm only taking 20%.
But yeah, all right. Well,
you got to be ready for it, Natty.
Yeah, all right. But yeah, it's just really, if you have a sense of purpose of what you're doing, you can then pick out the information appropriately that tailor to you, right? But if you don't know, and you really don't know where you're going with your goals or anything else, it's easy for you to really attach to one ideology and one training method. And again, us as human beings will do whatever is possible to affirm that what we're doing is right? I mean, how many dumb things have we done to, like, I mean, I can think back to so many things where I know that it's not the right thing to do, but because I don't want to be wrong, I'll double down on it and do it again.
I'm going to double down.
Guilty of that.
Yeah.
But all right. So speaking of that, though, right? When you were building Myokinetix, what were the biggest hurdles for you to overcome? Was it like doing something brand new, or was it making sure you didn't do stupid things that you knew you had done previously?
It was.
Like, was it scary? Were you excited?
Well, yeah, it was scary and excited, right? I think when you have that two emotion together, I think you're on a good path. When you have scary and excited at the same time, I think it's a good emotion. To me, was just being able to provide for my fiance at the time, just being able to make sure that we stay afloat. And I know I have, again, my parents, I watched them work. I've seen the incredible work ethic that they have put on me. I know that I'm going to make it work regardless, because that's just, I didn't have an option, right? It wasn't, I didn't have a plan B. It was just, hey, I'm just going to do this. The biggest thing is overcoming self-doubt. That you're going to have those days where you're like, man, I'm really feeling it. Like, is this worth it? Am I doing the right thing? But, you kind of go back to the drawing board and you take a moment to assess, and you just look back, and, you have, if you have a great partner that can support you and talk you through this thing, it's huge. I wouldn't be able to do it alone. And that's the huge thing. Nothing I did with Myokinetix was alone. I have, obviously a great support from my wife, from my family, the team that I built from the ground up. They're still with me. So, it's again, back to the tribe thing. It's the whole mentality that if you're embarking on any journey, anything that's challenging, you shouldn't do it alone. There are someone out there that's willing to help you, been there, or is going through the same thing, that can offer you some pointers. And I think if people can, is willing to be vulnerable, to ask for help, we'll all be in a better place for it, because there's nothing. It's really letting go of the ego, right? If you have your strong ego, you're gonna say, I don't need help. When in reality you do, right? And then fast forward, when you're 50, you're like, man, I should have asked for help. And now I'm like, oh shit,
I think that's one of the things that John has been really, really good at. And I've said this before, because I've known him so long, he's never spoken to me in a different manner. So I've always known him to kind of speak from his heart. And if he's had fears or whatever, he's always brought that to the forefront. But last week when Lauren was on, she just remembered hearing one of the episodes. She's like, John was really, really vulnerable. And I think that people see the vulnerability as a weakness, right? Like, I need help. I can't do this. But it's like, I don't know why people still feel like that, because saying I don't know is like, I'm confident enough to say I don't know what I don't know, kind of thing, right? And I want to learn. I want to be better. So I'm just kind of curious as to why people still sometimes see vulnerability as a weakness, when almost anytime you hear people talk about it, like you, right? You weren't mad, like too man to be like, I don't need anybody's help. Like, you come home, your wife's like, how was your day? And you could have been like, it was amazing. Shut up. Yeah. Right? Like, you probably came home and be like, today was a tough one. I don't know if I'm going to make it.
Yeah. I read this in Brene Brown, Daring Greatly.
Oh, yes.
Great book. Highly recommend to everyone. I read this over the quarantine, and she made a great point where, as men, with masculinity comes that perception that you are not allowed to be vulnerable. And, there's expectation for us to rise above the occasion, not show any weakness, really just kind of push through. And because of that, vulnerability is perceived as being weak, right? And I think we all can relate to that, where there's time where, you just want to call one of your friends and just vent about something, and you might just like not call just because you want to look soft.
Right. It's funny. I've heard of Brené Brown. She has a special on Netflix too. Lauren's like, you have to watch this.
Yeah. Her TED Talk is really good. I think you should watch the TED Talk first before Netflix.
Okay. I'm bummed we didn't bring this up last week. We were talking about, because Lauren brought up toxic masculinity based on how, her son, and she's got some very particular feelings on that verbiage being thrown around. And I was like, we missed it. To that point, what do you think about that term in and of itself, toxic masculinity? And I think that's a bullshit term. And I'm not saying that type of behavior doesn't exist, because those people do exist and that behavior doesn't exist. I think toxic masculinity is just the complete absence of what makes like the virtues of masculinity, right? Like leadership, empathy, and they kind of just throw this toxic word at it when it really should be, those are just toxic assholes, right? Like,
I'm not really familiar with it. If you guys can just kind of fill me in.
So most of what seems to go on is when, I guess the easiest thing is like a very misogynistic outlook. Like women have a particular place. All the Me Too movement guy, there would be men who would be like, that type of behavior is fine. If a woman dresses a particular way, then you should be able to say whatever you want. And, because I'm a man, I can talk louder than you and I'm stronger than you. So my opinion holds more water, like stuff like that. And feel free to add on to that if you want, Mike or Cliff.
Well, Cliff's the more toxic of the two of us.
So he should definitely tell us how he likes to beat up his girlfriend.
I'm picking on the guy that barely talks, so it's really for those of you not watching, Cliff has just turned a deep shade of red. Cliff has not beat his girlfriend, at least since I've known him.
At least since the restraining order went through.
Yeah, exactly. He's not a violent guy, folks.
No, not at all. And beating domestic abuse is never funny.
No.
Even if I'm trying to make it funny.
Yes.
Because I'm the asshole.
Not at all. We both are. But yeah, I think the whole toxic masculinity, you basically said it's oppressive.
Yeah.
It's men oppressing women in one way or another and just not treating them as equals, I believe is the proper term for it. Well, the proper definition.
Also men oppressing other men, and like, I'm sure you'll know what I'm talking about, like in sports, like especially like, I remember being in sports and like the certain coaches and especially like the coaches' kids, like there's no crying in baseball. You can't.
Yeah.
If you get hurt, walk it off, and the kind of stuff that I think is at the heart of this podcast, like not being vulnerable and not being able to talk about your emotions, that all gets wrapped up into like the toxic masculinity. Like,
okay. I mean, I think I think you have to kind of go deeper. Like, why would someone behave that way, right? To me, when someone behaved that way, I'm like, oh man, I wonder how their childhood was. That's the first thing that came to my mind, right? Yeah. Is that like, what kind of household did they grow up in? Like what did their mom went through that whole thing? So if anything, I feel more empathy because you guys know that when people are, those who shout louder doesn't necessarily mean they're right. They just need to amplify their opinion. And my opinion is that I just feel bad for them, and that's at the end of the day. Like, I'm not gonna fight about it because you can't change anyone, only yourself. And you can call them out and say, hey, you're being kind of a dick to saying that. They're not going to change. That's what they were imprinted upon, and it's really not your job anyways to change them. If we have a short amount of time that we're going to live, I'd rather spend it on myself, as selfish as that be, because if I can improve myself, I can be a better husband, I can be a better father, I can be a better son, right? And to me, that's what really matters to me. So, go do what you have to do to make yourself feel good. If you have to oppress people, then that's really it's a you problem. It's not a me problem. I don't need to fix you. At the end of the day, we all have to answer to someone at a higher being, and that's the choice they made.
I think that I agree with you. You can argue with someone if you want. You're not necessarily going to get anywhere. I believe whether you focus on yourself or you just focus on doing what you do, mm-hmm. I think you can kind of lead by example, right? Mm-hmm. And if someone who is exhibiting that shitty behavior can then look at you, whether from afar or up close or whatever, maybe your actions and how you interact with others and the impact you have on other people can help change their perception. It's a crapshoot. It's nobody. You're right. It's nobody's job.
Yeah.
But I don't know. I think that I don't know. You're right. Like it's the people who have the biggest shitty opinions always want to be the loudest. Like mm-hmm. just look through any Twitter thread, and you'd be like, man,
if I see anything in all caps, I'm not reading.
I will not listen to your written shout.
Yeah, I wouldn't do that. I guess just going back to the point before, it sounded like it's an overcompensation of being vulnerable, right? If I capture, insecurity. And I think there's just as men being vulnerable, I think it's totally normal. I think we need to be vulnerable, even like to the spouse. Like I'll let my wife know for sure. Listen, we have feelings, we have insecurities, right? I mean, and that's part of being a human being. I think for people listening to this, just to make sure that it's okay to feel that way. They're not alone, right? You're a big guy, you guys are big guys. So there's time where how many times where people size you up and say, oh man, you probably do this and this and this, right? Just kind of labeling you to do that. And I'm sure, in the past, there's time where people are like, oh, you must have been able to do X, Y, and Z, and just kind of put me in a box. Either if I was younger and, not as confident in myself or really trusting in myself, I would probably go along with that. Where now I can easily just say, no, actually, I'm not. And that's cool.
Mm-hmm. That's awesome.
Dave
opening up a fine beverage right now.
Yep.
Adult beverages. No, it's just Monster.
Spiked Monster.
John brings this up a lot too. But did you feel any particular way about 2 months ago, 2.5 months ago, when the Stop Asian Hate was a big thing?
I'm in my bubble in a way where I'll watch the news then and there. I see what's going on. I try to find two sides of things. I definitely seen the abuse, especially the elderly, any elderly. It doesn't matter. You're just a real terrible human being if you're just doing that. That whole movement, I totally get where they're coming from with that, and I think it's unjust to label someone and to say hey, you're. And this is real story where when in the beginning of the pandemic, where I was at Montclair with my wife, I was sitting down waiting for her to finish with something, and I sneezed, and then the person next to me just looked at me and was like, "Hey man, you can't be doing that." And I looked at him and I'm just I just kind of laughed, because if you know anything about sneeze, one cannot control their sneeze. It's going to happen.
Yeah.
So I was at a crossroads where all right, do I say something to this guy or I just shrug it off?
Or sneeze on him.
if I tell him hey man, you know that this an involuntary action, I cannot control it. Our body kind of does. He's not there to hear what I have to say.
Could say, be ready for this involuntary ass kicking.
Yeah. I just looked at him, I shrugged, and I just keep doing my thing. So
kept sneezing.
Yeah, I think people, again, going back to that, I think it's a way of it's a form of toxic masculinity in a way where you want to exert dominance on a certain group of people to make you feel good about yourself. But I don't think anyone have that kind of power over me. So I'm totally cool with just them saying, listen, man, if you insult me and it's going to make you sleep better at night for an extra hour, by all means. It doesn't do anything to me. Like, I don't even know you. I don't even care what you have to say. You have not proved.
Natty Bandasak over here.
No, but right?
Say that 5 times fast.
No.
Yeah. It's like you're not even worthy of me paying attention to you. Like, you got to have some like solid founding. I got to have like the same. We got to have the same vibe for me to hear what you have to say. If we're not that, then I'm not gonna listen to you.
Yeah.
I'm just again. I was brought up as a Buddhist, so it just maybe.
Do you practice?
I'm the worst Buddhist, so I don't really know much teaching, but I meditate every day. That's like how I find my ground.
Mm-hmm.
Every time I meditate, I imagine myself like Neo in the Matrix, where the bullet's coming, and that's bullshit, right? So I'm just like, all right, I'm just gonna go away. Yeah,
nice.
Yeah, so that's just how I'm. Like, you know me. Like, I mean, have you seen me get riled up at all?
I don't think yet, ever.
Yeah.
I don't think you've yelled or said one curt word about anybody, really.
I mean, I do get irritated when things are not up to standard, when I know that they can be done the right way, right? Mm-hmm. But other than that, I tend to be pretty mellow.
But I feel like even in instances like that, you would look at it as a chance to, like, how can I better my communication skills is it one of the people you work with? Is it your wife? Like, what can you maybe do better to maintain that kind of calm demeanor and just have that conversation instead of being like all about it?
Yeah. And this time when my wife's like, you don't get upset about anything. I was like, no, I work not to get upset. I was like, and times where I get upset because I got upset.
I get it. Yeah.
It's like, why did that person or that individual have that power over me for me to get upset?
Mm-hmm.
And
nothing get past my defenses.
Yeah.
I think the podcast you had on with Coach Lex,
yes,
that was a good one regarding stuff like that, right? Because she's a woman and she's a woman of color. And,
in a very male-dominated field.
Yeah, yep. And she said a lot. She said echoed a lot of the same sentiments. Like, I'm going to do my thing. No one's going to have any kind of power over me. And I don't know. Everything you guys were talking about was really, really great. Did she work with you guys at all ever?
So Lex is a friend. We refer people back and forth, but
and she's another DPT.
No, she's a strength conditioning coach.
Okay.
Yep. So we met through actually Instagram because she commented on one of the podcasts that I did, and we knew some of the same coaches, and it's funny how things work. And now she's in Jersey. I invited her to come on a podcast just because she had a very unique view, and I knew what she went through as far as like her ankle injury. So I figured she's the best person to do it. She's like a mom of two. So like, I mean, anytime I have moms on, I think it's great because the hats that they have to wear, it's incredible. Like, just to be able to care for a human being and then try to, do your thing with your career is huge. I give a lot of credits to that. And I think it's going back to, like who she surrounded herself with. I think that was one of the biggest talking point. If you surround yourself with people who don't get riled up on nonsense, then you're not going to be like, it's really like, I give a lot of credit to my circle who I talk to on a daily basis because, we kind of keep each other grounded in a way.
That's awesome.
Yeah. Yeah. Cause what are you going to like, I mean, I don't know how smoothly it runs here, but I'm assuming like, I don't know, is it smooth here? That's not very encouraging.
You're here
this particular building?
Yeah.
Not exactly. No.
Okay.
I mean, they've gone through some like team replacements recently. Are planning on going through more.
Okay.
Like trying to smooth things out, but yeah, not really.
And how's Jeff's quest?
That's pretty smooth.
Pretty smooth, only because it's like Mike, John, and I, and like 3 other people.
So who does it most of the stuff here when John's not here? Rachel?
Rachel. They have more of a sales team here. As Dave has pointed out before to us, not really much of a floor trainer presence. But we're working on that. We've got a new guy here. But yeah, mostly Rachel taking care of it.
If you could do anything differently here, what would you implement, you think? Or have you not thought about it that far out?
I mean, besides cloning myself. so they have me here too.
So you could train more people, you evil bastard. No, I'm just kidding.
Honestly, more team building, because especially in like the a lot of sales and training sales stuff coming out of like the old New York sports way of doing things. There's a lot of like
is it the
butting
same?
heads and competition, and well, because a lot of our people were previously employed there. But there's a lot of conflicting egos, and
Are people trying to just make money, or are they trying to make the club better than what it is? Because there's clearly a difference.
I think it's more of the former than the latter, unfortunately.
Do you do team building?
Yeah, I mean, we have weekly meetings. It's have to be cohesive. Each staff needs to really believe in what we do as a mission. Because I don't want to create a culture where I can't stand.
Right.
And that's a huge thing. And, having those individual meetings or like a team meeting is huge, just to kind of get a sense where things are going and where it is, where it's going, what do we need to stop doing. I think that's the biggest thing. Like what kind of behavior we're not going to tolerate, right? And it's huge. And in any business, you relying on good people to help you run your business. And once you get the people in, you got to make sure they work together. That's a huge thing too. It's like the interaction, because this is not like a puzzle where you just like put it there and it's all done. You have to watch the interaction and how they interact with each other, and how they interact with each other in the presence of you, interact with each other without you, with the client present, and et cetera. It's just a lot of moving parts, but as long as you can find people who believe in the mission, like you said before, that's because also then you really find some good employees where you can have and you can trust that they're going to make decision based on what's good for the business rather than self-interest.
Right. Like, what if you guys had to do team building here? What would you want to see?
Trustful.
I mean, even just starting with more meetings, like we've met twice. I think one of the biggest hurdles, like we had sort of big plans, but then we did the lockdown lifting. We ended up opening a lot sooner than we anticipated, and we didn't have that time to sort of meet everyone and come up with like a cohesive culture and plan. And since then, like I said, we've met as like the trainers, we've met like twice since we've opened. And part of that too is like they put so much on, like John and Rachel. Like John isn't just the fitness director. He also does payroll for both of the gyms. He's the building manager for the Jeff's Quest building, so he has to deal with the tennis and the basketball there. And
that needs to be separate stuff.
Yeah.
When I had a meeting with ownership a month ago, he was like, is there anything else you'd want to tell me that you would like to see here? And I was like, well, Juan, my direct supervisor, the fitness director, I was like, it'd be nice if he wasn't angry at so much random shit all the time. And he kind of chuckled, because I was half joking. And I was like, actually, you know what, Jeff? I'm like, he's very loyal to this place, much like John. But I was in the office and he was doing payroll, and he was kind of aggravated having to do payroll. And I was like, that's not really his job. I'm like, if you want him to run the fitness department and you want to have him build it to something that you both believe in and you trust him, get the administrative work off his plate and let him do the fitness thing, right? Like the busy work you can give to anybody or hire somebody else, but you can't really help develop culture when you're doing like just checking off boxes for like paperwork. Exactly. It's just not the same. You agree, Natty?
Yeah, absolutely. I always say, like, if I hate doing this work myself, someone is going to hate it. Unless I can find someone that's really love it, then that they deserve to do that work. I think you put people in a seat where they can best succeed at, and that way, there's a lot of camaraderie, celebration within your team, and that's a huge thing. You don't want people to, the last thing you want to see is your employees sitting in the parking lot on a Friday, looking at their clock to see like, oh man, I gotta go in, right? Because we all been there. Like we all have shitty jobs. Oh, yeah. But yeah, no, I believe in leveraging people, putting them in a place where they can succeed, giving them the resources, the tool to do the job you want to see them do well at, or potential position that you want to create for them. But listen, every job has a really, I guess, shitty part in a lack of a better word to say. But that should only be like maybe 10, 20%. It shouldn't be the entirety of it. Like 80-20 rule, right? If 80% of your day is really good, you can get by. And human beings also tend to only focus on the negative part, right? So if they have a lot of negative things to focus on, that's all they're going to focus on. Give them reason to love why, to love their job, to love the company they work for.
Do you guys have the lateral movement to, like if you wanted to present, I don't know, do a presentation, muscle of the week or month, or if you had like a new like pitching program you wanted to say, hey guys, this is what I have going on for Mike. I want everyone else to know about it. That way, if you come across members or kids on the floor, then you can just send them to me. Like, can you guys do that if you wanted, or do you have to like pass that by somebody?
Well, I have more freedom than Cliff does because I'm 1099.
Oh, okay.
So I'm an independent contractor.
Right.
So I'm technically not an employee.
Okay.
So am I.
Are you?
But
touche.
But you get paid through the club, right?
Yeah, I get paid a split through
I pay the club.
Okay.
So it's different in that regard. So there's, less that I have to go through.
Okay.
Because technically you are employed. Am I correct?
No.
No, you're not?
Everything I get paid $10.99. I do my own taxes. It's just I split the training with the club.
Yeah.
And I mean,
not to put anybody on the spot, I just want to see if you guys figure, like if it's a good idea, I don't know, just start doing stuff and see what sticks.
As long as it doesn't cost the company any money, we're allowed to basically do whatever we want.
I have a little more freedom than he does.
Just like when you let's get Paulie down here as soon as fucking Canada opens up.
Yeah, exactly.
That would be great.
Yeah. Exactly.
Well, I mean, if you guys are all 1099, then it's really hard to have employees to invest in the growth of the company because as an independent contractor, you have really no skin in the game. Yeah.
No, well, you're right, but if I look at it from my perspective, being I'm not necessarily I have the RPM brand under the brand of the gym, but I also understand that the amount of visibility that the gym has as a whole and the amount of people coming through there, I can leverage that reputation through me as long as I also buy into, let's say, the mission statement of whatever the gym is. So we can kind of benefit from each other. It's just like I said earlier, why would someone in that area go to the gym? Oh, well, they have RPM nutrition there if that's something that they're looking for.
Yeah. It's definitely got to be relationships that work both ways.
Yeah. So these guys can do the same thing. I this isn't. I hope this doesn't come off as insulting or anything because it's not. I just think that because everything is so lean here right now, it's still trying to find the identity on where it should be going.
Absolutely. To what you said, what you said about the gym, like you can they have a mission statement, they have something going on, and people want to go there, and that helps you and RPM and whatever. This company doesn't really have a mission statement.
Right.
Mission statement is make money. We want to exist and make money. That's all and absolutely what Natty said. We do have, like, I'm bought in because I like John and Rachel and the management, and I have a good relationship with them, but a lot of the other trainers who are also the 1099, they're not really bought in, and they're making money other places. They're making money Orange Theory or in homes, and ultimately it's what incentive do they have to build business here? Not
to work.
Yeah.
Which is very important.
I get it. But to Cliff's point, you're invested in the right thing. You're invested in the people you know, John, Mike, Rachel, whoever else because if you don't necessarily care about the building, it's fine. You don't have to. But those people that you do care about are in this building. Mm-hmm. So if you can help further them in some way or help them get stronger at what they do, then eventually the building wins anyway.
Yeah.
And then step 1, step 2, step 3, whatever. You're always going to get people that we had. Englewood used to have 30 trainers, right?
Wow.
I think when we reopened just for training in July, 4 of them came back. That's not a lot. Everybody else was from Montvale, right? So you walk in there, you think it's Montvale essentially because there's so many of us now. But it does go to show you that the people that came back, they bought into what we had going on there. And I think it's kind of helped us figure out a little bit where we're going, programs that we want to do. And like we've hit the online stuff really hard. So I don't know. If you have good ideas, just start throwing them out there more and more and more. They're not all going to be awesome. Not everyone's going to agree with them, right? But I think the more leadership roles you guys can kind of assume, it's just going to – like you'll find your grooves, right? Mm-hmm. And then other people may just follow. Or whoever signs the checks, so the owner guys out in Arizona.
Something like that.
Yeah. They'll be like, hey, you guys are doing some good shit. Let me shuffle a couple more bucks to you and you can try this stuff, I don't know. I just think it's very uncertain times, but that also usually breeds the greatest creativity.
Yep.
Yeah.
I don't know. That was thanks for coming to my TED Talk or let me step on my soapbox for 10 fucking minutes here. Natty, anything else you'd like to share with us or ask us before we sign off?
I think it's pretty good. I think we covered a lot.
Okay. Gentlemen?
Yeah.
Mm-hmm. Natty, where can we find you?
Yeah.
Just
blow out all your accounts, where's the addresses from where you're located and how we can find you.
So first and foremost, my clinic is Myokinetix, MYOKINETIX. You can find us on social media, Instagram, YouTube. We just got a new YouTube page. It's awesome. All out.
What's on that? I saw that. So
post. All the exercise library that we have from helping, flexibility to strengthening, single leg strengthening, from, if you want to be a runner, we have all the cool stuff for you guys. And every month we have different kind of series coming out. So that's there. The podcast is on all the platform, Spotify, Apple Podcasts, etc. And
Anchor?
Website, same thing. I don't know if I'm on Anchor. I don't know. I use Buzzsprout. So
okay. All right.
Yeah, I like Buzzsprout. Facebook. Yep. So you guys can find us on Facebook. Give us a follow.
Tinder?
No Tinder. No.
Damn it.
MySpace.
Oh my God. Yes. Top 5. Yeah. And then Instagram, you can find me. My personal page is Pain_Jedi because I'm a huge nerd. So you can find me there.
Who's your favorite Jedi Master? And don't say yourself.
Oh, Jedi Master. Well, it's gotta go Yoda. Super wise. Yeah.
Right,
yep. Yeah. And that's it. I think that's. Oh, the address is 55 Eagle Rock Avenue in East Hanover.
Which clinic are you at mostly?
I am at the East Hanover one.
Oh, so guys, you all want to go to the other one.
That's my headquarters. So I'm spending a lot of time there. We're doing a lot of groundwork. So, we're having some fun. It's good.
All right. That's awesome. With that, Natty, thank you for coming on. Mike and Cliff, always a pleasure.
Thank you. I appreciate you guys for having me.
Good night, everyone.
Good night.
Good night.